So Anne, if I'm a public safety officer, firefighter, EMT, police officer, whatever, and something has happened, and I know it's affecting me, but I don't really know if I'm ready to pick up the phone and call a professional. How do I know when the right time is?
Okay. Well, I tell people a lot of things are therapeutic, not just therapy, right? So exercise pretty much trumps everything, medications and therapy. So pump up your workout if you're working out. If you're not, it's a good chance to get some cardio skills on, get some running on. Spend a little extra time with friends and family. If your department has a peer support team, reach out to somebody like that. Reach out to somebody on the peer support team. If there are things that usually make you feel better, do a little extra of those. If you usually feel better when you go fishing, if you usually feel better when you take your kids to the sporting events, then do those things. If things get worse, or if what usually makes you feel better doesn't work, that's time to reach out and ask for a professional.
That makes sense. That makes sense, except you just told me to get out in the world. And I really don't want to be in the world. What's happening to me is I want to withdraw from the world.
Right.
How do I make that happen when that's not what I want to do?
Yeah, that is, isolation is actually torture. Right? So when firefighters get in a situation and they started to, things started circulating and things started going wrong, and they tend to withdraw, they tend to isolate, that's when things get worse, actually. If you think of what we do to the baddest of the bad in prison, it's solitary confinement. Right? So isolation is going to make it worse. And that is a struggle, is to get out and be with people and be with the peer support team and your friends and family.
So even though I don't feel like doing that, do it.
Yep.
And if that doesn't work, then it may be time to think of something.
Then it might be time. Yeah, you might want to call the chaplain on your team, on your fire department. Or you might want to reach out and ask for a professional.
Okay. When I think of professionals, I see all these shingles out there.
Right.
I see MSWs, Master of Social Work. I see psychiatrists. I see psychologists. I see all kinds of things. I'm not quite sure what the difference is, but first, what's the difference between counseling and therapy? Two common terms I hear.
Okay, sure. So,
or are they the same thing?
So the term therapy can apply to any different thing. It could be occupational therapy. It could be physical therapy. In this case, psychotherapy is psyche, the care of the soul, right? So psychotherapy, shortened for therapy, and counseling, I use those interchangeably.
Okay, and they're used interchangeably in the profession?
Yes.
Okay. So what is the difference in all the different kinds of counselors and therapists that I see out there? Everything from social workers to psychiatrists, psychologists. What's the difference along that spectrum?
Right. So all of the professionals that you just mentioned have bachelor's degrees, 4-year degrees. Okay. Social workers have 2 years of additional training. Sometimes that's focused in case management, finding legal help and in housing and such. And oftentimes they can do therapy as well. Okay, psychologists, we're doctors. We have a doctorate degree. You might see a PhD behind our name or a PsyD, PSYD behind our name. We're doctors, but we're not physicians. Okay, so psychiatrists are medical doctors. They're MDs. They're physicians. They have special training in the psychiatric illnesses, right? So like schizophrenia, anxiety, depression, and they use medications to treat those illnesses. An oncologist is a medical doctor and specializes in cancer.
Right, so it's like, okay. Is one of those types of counselors more appropriate for certain kinds of problems? And how would I know, in any case, if I just knew there was something that I wasn't comfortable with about myself?
Right.
Or do I just start?
Okay, so a couple things. One, the studies have shown is that what's successful, when therapy is successful, it is about the relationship. It's about the connection. It is about the fit,
Okay.
Okay? So if you know that your particular difficulty is work-related, then you want to choose somebody that specializes in police and public safety, right? So someone who has a 2-year degree might be just as helpful as somebody who has, 8 years of training like myself, if we specialize in police and public safety. Or if you know right now that medication is something that you want to try, right? You might want to start out with a psychiatrist and say, okay, I can't get out of bed. My depression is so severe. I want to try an antidepressant first, and then we'll try talk therapy. So you might start there. Oh. You might say, my difficulty is with God, right? My difficulty is a spiritual struggle. Then you might want to seek out a chaplain, for example.
Okay. I think there's this perception among people not in the profession that somebody with an MSW is sort of a low-level practitioner, and somebody with an MD is this high-level practitioner. And I mean, is that really true, or is it really more just about their experience and their expertise and the connection?
Okay. Well, certainly if you have, 8 years of education, you have a wider knowledge base than somebody who has 2 years after their bachelor's degree, right? That being said, if someone has a 2-year degree after, like a social worker, they may have, 15 odd years of experience with police and public safety, and a new psychologist starting out doesn't, for example.
Okay.
Right? And the other thing is we do different things, right? A psychiatrist specializes in medication, right?
Okay.
Just because a person is a psychologist doesn't necessarily mean they specialize in therapy, for example.
I know that I'm not feeling right.
Yeah.
I mean, I've recognized the point. I've gotten to the point where I recognize I'm too irritable, I'm drinking too much, I'm snapping at my family who I love.
Sure.
I'm distracted, whatever. Where do I need to get to where you would recommend that I pick up the phone and call somebody?
Okay.
What are the telltale signs that now's the time to pick up the phone?
Okay. Well, in one case, the case you just mentioned, someone might be suggesting that it is time to get professional help.
Okay.
Right?
Yeah.
So, so you might think, okay, this person I care about and I love has my best interest at heart. They're saying I should get some help. Then pick up the phone. On a more serious note, I am really humbled oftentimes by how long people suffer before they pick up the 500-pound phone and give me a call. I am humbled that to imagine somebody who has not slept well, who is on the verge of divorce, who has been, upset and irritable and lashing out. No matter what they did, it didn't matter, feeling hopeless for 2 years. All of that wasn't as bad as walking in my office. I think people suffer too long.
It's awfully hard for those of us in public safety to think we need help, because we are, we're the superheroes of society, really.
Right.
And whether we like to, we often think of ourselves that way.
Yes.
How do you get over that hurdle? What have you seen in your career make people with that kind of outlook finally realize I need to go see somebody like you?
Well, what they're doing just doesn't work anymore. Or maybe they realize, hey, we're all human. We're all human. I don't know how to get out of this box because the directions on how to get out of it are written on the outside, and other people are noticing this. Sometimes it's something really, really bad or really awful that happens in their personal life or in their professional life, where the straw broke, or there's just too many trucks parked in the garage, or there's too many rocks in the backpack, or what have you.
Gotcha. Okay. So let's quickly address the issue of confidentiality.
Right.
Because that's what keeps a lot of people that think that maybe there might be somebody out there smarter about what's going on with me than me, from actually picking up the phone. So if I pick up the phone, if I'm seeing you, if I'm seeing any one of these other kinds of professionals that we just talked about, tell me about confidentiality. What must they disclose? When must they disclose it? And what can't they disclose?
Okay. So first of all, we don't want to disclose things, right? Our license is on the line.
Okay.
Okay. If a provider like myself breaks confidentiality, we could lose our license. We could lose our career, right?
Okay,
That's a serious thing for us. There's really no motivation for us to do this.
Okay.
Okay. Confidentiality is a legal concept, right? It's illegal. It's a law in states. Okay. In California, we're mandated reporters, just like the first responders I work with. If you tell me that a child is being abused, if you tell me that an elderly person is being abused, someone is stealing grandma's social security check, we're mandated reporters for those types of things. If someone tells me they are going to kill this person at such and such a time, we have a duty to warn that person. We have a duty to warn, we have a duty to break confidentiality in that situation. If a person is thinking about suicidal thoughts or thinking about killing themselves or hurting themselves, that's not reportable.
Okay.
A plan, somebody who has the means, somebody who is going to do that, then I might break confidentiality in that situation. I might call their emergency contact person, right? You listed this person with this phone number as an emergency contact. Let's call that person and see if they can stay with you tonight. That might be a breach of confidentiality in that situation.
It sounds like what you're saying is if a specific person is, if you have reason to believe that a specific person is definitely in danger with information that I'm giving you, that is the key.
Well, the future is the key, right?
Okay.
So if someone if somebody tells me they have hurt someone, that's that's not reportable unless it's a child or an elderly person, right?
Yeah.
So if they say I am going to harm this person, that's reportable.
What about general kind of thoughts about violence or wanting to lash out in general? Is that going to cause you to call, to tell somebody, to tell on me?
Ralph, oftentimes lashing out at people is what landed the person in my office in the first place, right? So they're having difficulties because they've been lashing out, right? And so if we talk in my office about how things are just at the breaking point and they are yelling at everybody and they are irritable and they are cranky and not their normal self, let's talk about that. If things are so bad that the person in my office is thinking about killing themselves, if things are that bad, let's talk about that. Let's talk about those thoughts. Let's talk about those ideas and the reasons for all that.
What I hear you saying is that if I'm going to hurt somebody, then you are mandated to keep that person safe. But if
or warn that person.
But if I am telling you that I'm having thoughts or fantasies about hurting people, that is not something you really need to do. You need to break confidentiality.
Right. Everybody feels like they're going to lose their temper. And if this kid does this thing one more time, they're just going to lose it. That's the focus of therapy. That's what we're going to talk about.
And it stays with you.
Yeah, yeah.
Okay. Same with suicidal thoughts? If I'm saying I'm feeling like it's not worth going on,
right.
That stays with you?
Yeah, nothing I do is working. I'm feeling so hopeless. It doesn't matter what I do, nothing seems to be working. It doesn't matter how hard I try, things are not going to get better for me. That is the focus of therapy.
Okay, so that's the purpose of being there.
That's the purpose of being there.
Gotcha.
Yeah.
Okay. So I've gotten over the notion that I might need to talk to someone who's an expert in these kinds of things. How do I go about it? There's so many people out there.
Right.
Do I just pick up the phone and dial randomly, or how do I find the right person for me?
Good question. Okay, so A couple places to start. One is the website Psychology Today has a good find a therapist function.
Okay.
And you can search by insurance coverage, by zip code, by gender, by problem type. You might click off the box that says post-traumatic stress or divorce or ADHD, whatever your problem is. You can search by language. They have a great search function. So you might start there. If you have insurance, your insurance might have a list of providers that they will pay for. Okay? So those are some places to start. You might also ask a friend or a family member or a coworker. Sometimes providers have reputations with departments.
So I've narrowed it down to a few people that I think might be helpful. I need to pick one to start with. How do I do that? What questions do I ask when I call?
Okay, so you might ask about experience with police and public safety. Okay, have you treated post-traumatic stress? Are you familiar with the culture of the fire service? Okay, have you done this before, basically? You might ask about how long they've been in business. You want to make sure that they're licensed. Anybody who's on an insurance panel should typically be licensed in their state.
So I found somebody with experience. I found somebody that has some understanding of my job or has worked with public safety professionals before. That seems like they might be a good fit. Do I need to worry about what their approach is? I mean, is that my job, or is that the therapist's job to figure out whether their approach, the approaches they're trained in and comfortable with, work for me?
Okay, well, a couple different things. One, let's say you're wildland fire. Okay, and so it's spring, and maybe you want to, talk about a couple things before the fire season starts, so you can enjoy, fire season as much as possible, right? So you might want to say, I'm looking for some brief therapy. I'm looking for some short-term therapy. You might be in a situation where an elderly parent is dying. Okay, this is a horrible situation, but it's time limited, right? This is grief. You're dealing with a grief issue, and so you might want somebody with that type of experience and that type of focus for that type of problem.
So you're saying therapy doesn't have to be long term; it can be time limited. It can be short time limited.
It sure can. It sure can. Yep.
Okay.
Sometimes it's 1 or 2 sessions. For example, sometimes a session can be just literally reminding the person of, well, what used to help, right? What did you do the last time you had this problem? And just reorienting them and reminding them of what they used to do that helped. Another situation, it may be that in one session you realize this is actually a medical problem. This isn't psychological, this is a medical problem. It looks like a psychological problem, but you need to see your medical doctor.
Okay. Would the same thing be true if I came to you and you were a practitioner, you had a certain approach, you had certain techniques that you were trained in and were comfortable with? Would you recognize that those might not be the right techniques or approach and refer me out to someone that was more appropriate for me?
Yes, and the reverse also might be true, right? The firefighter might say, this isn't working, I need to find somebody else. Do you know anybody else who does this, right? Or like in an example you just gave, I don't treat eating disorders, right? Or if somebody gives me a call and says, I have postpartum depression, I don't do that. That's not my type of work.
Right. So if we're working together, I've had 1 or 2 sessions with you, and I mean, obviously, no practitioner in any field knows everything. So you've got certain approaches, certain techniques that you're trained in. Whose job is it to recognize that those techniques or that approach may or may not be the best approach or technique for me? Is that your job or my job?
I think it's mutual.
Okay.
I think it's mutual. Certainly, if you're the firefighter sitting with a therapist and you feel like you're doing all the talking, right? Or you're not getting anywhere, you can certainly ask for some specific suggestions. Or you can certainly speak up and say, I don't think this is going anywhere, right? The therapist might say, so last time when we met, we talked about this, and this time let's look at it at a different angle.
Okay. One of the banes of MDs, primary care physicians all across the country, is their patients come into their office and say, "I've been searching on the internet, and I know I need a prescription for X," and it just drives doctors crazy. They go, "Oh, wait a minute, let's talk about."
Right.
Okay. So,
right.
do people come in to you? How useful is it for someone to call you and say, "I think I need X, cognitive behavioral therapy, or EMDR, or whatever therapy that they've been reading about"? Is that useful or not?
So yeah, sometimes that does happen, and sometimes it is useful. In the case of cognitive behavioral therapy, a lot of people know that term, right? And it's popular, or people have heard of that, or that makes sense, so they might be asking for that. Cognitive behavioral therapy is looking at your thoughts and what you're actually doing. If you're working out, if you're taking your dog for the walk, what is your behavior if you're yelling and screaming? And then your thoughts, what you're thinking about the problem, how that's influencing your mood. So if you know that that's helpful, you can ask for that. But again, it really is about the fit.
Okay. So it's about. So I keep hearing you saying it's about the fit. And so I guess to wrap up this line of questioning, let me summarize it for you and see if you agree.
Sure.
It's really important to find someone that you're comfortable with, that seems to understand you,
Yes.
your job, what you've been through.
Yeah.
And if the approach that professional is taking doesn't seem to be fruitful, it's really their job to let you know that and to recommend something else. Is that true? Okay, good.
And if you have that sense that this isn't working, that this is not helpful, I'm not feeling any different, I'm not feeling any better, it doesn't mean that therapy's not helpful. It may mean that a different professional is better for you, is a better fit.
Okay. So what is therapy like? I mean, this is a big fear for people who've never been through it. What is it like?
It's a conversation. It's a relationship. It's a very unique relationship where you get a different type of attention than you do in any other situation. But we talk. We talk about problems. We talk about what's going on in a person's life.
It's a conversation.
It's not magic. It's not voodoo. It's not New Age.
You're not doing anything physical, like
No,
rewiring?
not rewiring the brain.
Okay.
No.
Okay, it's just talk. So what's the first session like with a new client?
Well, typically there's paperwork.
Okay, yeah.
Sometimes people want to start out with what's going on with them right now. They might say, okay, here's the situation. My ex-wife and I are having a lot of problems. Our son is not doing well in school, and I'm not sleeping well, and I'm lashing out at my coworkers. This just isn't like me. So they might talk about what's working or what's wrong, what the problem is right now in the present. They may also start with something from the past. They might say, okay, I went on a SIDS call this time and it was horrible. It was a horrible situation, and I don't understand why this particular SIDS call was so awful when I was on 3 in the last 6 years, and I seem to recover. I seem to get over those or get through those. So a person might start with the situation from the past. The other option is that a therapist might start asking the questions. They might have some starters. I also think that a great line for a new client is, so where do we start?
Okay. Who's in control in therapy? I mean, one of the big fears of people in public safety is that we have invested a great deal of emotional energy in maintaining control.
Yeah.
Both of the situation out there and
Right.
what our reaction to it. So who's in control?
Right. It isn't about that. It's not about control at all. It's not. No one's going to force you to say something that you don't want to say. You can leave at any time. The door's not locked behind you. It isn't about control. It's about a relationship, right? It's about two people talking about what's going on with you at this present time.
So we talk in therapy. What good does talking do? I can talk to my buddy. What good does talking do?
Yeah, it's amazing. It really is amazing. I wonder that too. Like, how does this help? It's just, it seems miraculous and amazing to me too. But yes, it does help. Some people will say it's like a weight has been lifted off their shoulder. They just finally need to get this one thing out. And when they finally told another person this, they feel some relief. They do feel better.
I can see why talking would help. I mean, I think that's kind of obvious when people think about it, but why is it so important in some cases to talk to a professional?
Okay, so we obviously have some skills and some education. This is what we do for a living, right? Sometimes it takes that outside person. Let's say, for example, you've been having this thought about this call that went horrible, several years ago, and it's been running around in your head, woulda, coulda, shoulda, woulda, coulda, shoulda. When you go to a professional and they say, okay, let me ask you this. If that same injury accident were to happen in the parking lot of an emergency room, would that patient have survived? And the firefighter can kind of think about it and say, well, no, the injuries were not life-sustaining. They were too catastrophic. Sometimes it is that question, or questions like that really make the difference, and that's the turning point for that firefighter.
So, if I understand you, what you're saying is that because you do this all the time, and because of your education and experience in this, you know what questions to ask and how to gently guide the client's thought process, whereas some random person off the street probably doesn't.
Not necessarily, no. No, some random person doesn't always know. And there may be things that you don't want to share with your neighbor. There may be things in your life that are too private and too personal to share with somebody that you work with. It may be too private.
Which brings us, of course, right back to confidentiality.
Right.
And I know you have a serious side, but I see you laughing a lot. And it sort of runs counter to my notion of what therapy might be like, because to the uninitiated, we tend to think of therapy as sort of this dark, heavy process. Is it a light process? Do you laugh as much in your sessions as you are doing with me now?
Well, okay, a couple things. Yes, we are going to get to the hard stuff. Yes, we are going to talk about some really difficult calls, some really painful things. But at least in my business, police and public safety officers have a pretty, dark sense of humor. And amongst the general public, I think sarcasm is a lost art, right? And, the police and public safety psychologists that I know, we have just a warped sense of a humor as our clients do. So yeah, we do laugh. We do laugh.
So it's not a comedy session, but it's not dark and heavy either.
No, it's not as dark and heavy sometimes as people think.